Hello and welcome back to the Patient First Podcast. I am your host, Dr. Bryan Laskin, and I'm so excited that you're here. We have a really important topic today that has really been on my mind for a while. I've talked about it on this podcast before, but I think we really have to highlight it. Double click on this topic and really expand on it a bit to make it relevant so that everybody kind of understands the state of what's going on with a big problem in dentistry and with our public. If we're the stewards of oral health in dentistry, it's a topic that we have to address. And I have new information that I think will help address it directly that I'm excited to share with you. The topic that we have is dental emergencies. Now, big issue that I have personally with how dental emergencies are handled is that about 30% of dental emergencies end up in the emergency room, not in dental practices. They go to an emergency room or an urgent care center at a hospital to be seen for a dental issue. And we all know this is problematic, and we all know this in the industry. We know that this goes on. And I've been talking a lot about this because we're working at toothapps to bring medical and dental integration, not the integration theoretically, but the actual technical integration where you can bring in your medical records from Epic or Cerner or whatever EMR, electronic medical record that the patient has, and bring it to dentistry. If a new patient comes into your practice and they say they don't have diabetes, but they were just in and got diagnosed for diabetes 3 months ago at their physician, that'll pop up and you can have the conversation with your patient. Hugely important, right? So we're talking about a real integration between medicine and dentistry, and obviously connected dentistry, which is what we're doing at ToothApps, and that will help solve this issue. And we do that not just through ToothApps, but with our ToothApps Connect solutions, of which we have a great one in the TeleDentists. And the TeleDentists put an ad that I saw on social media, and their teledentist, just so you know, it's a teledentistry application, yes, just like other teledentistry applications. But what's unique about the teledentist is they have a network of over, at least last time I talked to them, over 300 dentists that actually do the teledentist visits when you're not there. So if it's 2 o'clock in the morning on a Saturday and a patient is on your website, they have a dentist that can take that call. Hugely valuable, hugely valuable. And then of course they'll send the patient back to you send the patient to you when that patient needs care. So somebody can field those calls on your behalf. That's the sort of what I see as the unique proposition of the teledentist. And they're one of our first ToothApps Connect solutions that I'm really excited to work with them because of that, because it is so directionally aligned in putting patients first, getting the access to care that people need. And when the teledentist did a survey of their people that came to their site, the question that they asked was, did the teledentist service prevent you from going to the ER or urgent care? Right. So we talked about that. 1/3 of dental emergencies roughly go to the ER or urgent care for care. And by their statistics, the teledentists, the average amount of time that's spent for these patients in the ER is 4.2 hours, almost 4.5 hours, over 4 hours. That's, that's just half the waking day. Are you kidding me? It's a lot of time. 4 hours in an emergency room for a dental emergency, which then you still have to go to see a dentist and get it taken care of. It is, it's just moronic. And you think 4.5 hours, holy crap, that must cost a lot. And the answer, my friends, is yes. The average cost for an ER visit in the US is $1,210. So that's approximate numbers that the teledentist came up with on their same advertisement. So 1 in 3 dental emergencies ends up in the ER or urgent care with the average amount of time spent in the ER of 4.2 hours and the average cost over $1,200. This is just a philosophical wrong that we have to correct. And the reason why I'm bringing it to you today is that the answer to did the teledentist service prevent you from going to the ER or urgent care, 84% of the time, the answer was yes. 84% of the time, when there was an off hours emergency that went to a practice's website, and there was a dentist or there was somebody there that could field that teledentistry emergency call, the patient didn't end up in the ER with over 4 hours and over $1,200 of estimated treatment. So, my friends, what does this mean? It means that there's a whole lot of people looking for dental care after hours when we're not there, when or maybe we are there and we're not picking up the phone. So, should we give patients access to teledentistry services for emergency care, whether it's handled by us or by somebody else? The answer, I believe, is emphatically yes. And we are not doing that as an industry. So that's my call to action today, is that it's easy to do. At ToothApps, we have a free teledentistry service. Just go to toothapps.com and you can sign up for free to use a teledentistry service. And we can show you what that looks like. And one of our partners, the teledentist, if you don't want to take those calls ever, they have people that can do that for you. So just add teledentists as a solution to your ToothApps account, and they can take 84% of those patients that are reaching out to you and make sure that they don't end up in the ER, don't end up in urgent care. They end up where? In your practice. So you can see them probably take 40 minutes instead of 4.2 hours, right? And probably charge them $100, not $1,200 for the same 40 minutes and $100 that you probably would have to charge them, obviously, depending on what they need. But you'll save them the 4.2 hours in the emergency room, in the urgent care, and the $1,200 84% of the time. So that is a big, big deal. So, again, I think it's vitally important for us to be available for our patients and for new patients and for emergency patients on our website all the time. I've talked about that before. What's unique about today is I've got some new data from the teledentist, and that if you don't want to handle those, you don't even have to ever field these calls or do a teledentistry visit. Just sign up for the teledentist and they'll do it for you. Or if you want to do it on your own, that's available too. You can turn them, their network can be turned on and off whenever you want to, and you can handle them yourselves if you like. So, my friends, if you want to learn more, go to toothapps.com, TOOTHAPPS.com. And I urge you, if you're in the dental profession, to seek out, put teledentist services, particularly for emergencies, on your website. It's a very big issue that we can solve as an industry. And if you're a patient and you have a dental emergency, frankly, I would look for somebody that you can reach to that practice after hours versus going to the ER. If you have what you might think be a dental emergency, don't go to the ER or urgent care. They're not very good at helping patients with oral problems, and that happens a lot. So oftentimes, if what this data shows is that a patient with a dental emergency will go onto a website and then bounce if they can't reach out to the office and go to the ER or the urgent care. So patients, don't do that. Look for another dentist that has emergency request forms or teledental services on their website to take care of you, so you can at least get the consult before you spend 4.5 hours and $1,200 in the ER. And dentists, let's make it easy for them and put these services on our websites and make it ubiquitously available for people to get care outside our office hours. And frankly, a lot of us during our office hours, because we're just so slammed every day, all day long. It's not feasible to expect the business team to field these calls in most practices because they're understaffed. They don't have enough team members to actually just take the phone calls that are coming in, let alone do true teledental one-on-one conversations. At least have a form, which again can be free at ToothApps, a form for people to fill out so that you can get back to them immediately, so they can take photos or videos of their teeth. And let's work as an industry to drop the percentage of dental emergencies that end up in the ER or urgent care. That's my call to action for you. If you have other ideas, I love when you comment. If you like what I'm saying, like, comment, subscribe. And if not, I'd love to hear from you why you think that this is not a big issue. You don't think that there's that many people going to the ER, or if you don't think that having these services available would be helpful for patients. I think it's one of those things that in dentistry I think is a total no-brainer. Being available outside office hours for people to contact you for dental emergencies directly from your website is a true no-brainer. It kind of boggles my mind that's not happening ubiquitously in the profession, and it is hurting patients, right? If your goal is to put patients first, we must make it available for patients to get access to us during when they have an emergency, both patients of record and new patients. And we can do that without us even doing it through the teledentist. So if you want to learn more, again, go to toothapps.com and let me know what you think in the comments below. Thank you, everybody. And I look forward, of course, to seeing you right here next week on the Patient First Podcast.